In the studio with me, we got a studio full now. If you've ever seen the River Country studio, you know it's like the size of a closet. So we are all gathered up in here. We've got Dr. Ravi Ramakrishna. Also, we've got Allison Heil. First off, everybody, can you tell us a little bit about yourself and what's your role with Riverside Healthcare?
Well, I'm a breast radiologist at Riverside Healthcare, and I am my training is primarily in breast imaging and dedicated to the early detection and screening of breast cancer.
All right, welcome to the show, Allison.
And my name's Allison. I am the breast navigator at Riverside. I work with Dr. Ramakrishna and our staff, helping women who get a breast cancer diagnosis.
What we're getting ready to talk about is something that just about everybody out there can relate to in some way, whether you have dealt with breast cancer or you know somebody who has, maybe your family member. I myself, my mother is a breast cancer survivor. So I want you to tell us who out there should get a mammogram.
That's a great question. It's a common question. There's a lot of confusing information out there these days. The recommendation from the experts for breast cancer screening is annual screening mammogram starting at age 40. That's what we know and we have evidence for that reduces the chance of dying from breast cancer the most, and that should continue as long as you're in good health.
So is there any instance where people should do it earlier than 40?
Certain women may benefit from earlier mammograms or other type of testing if they're identified as high risk. That's a great question. Riverside does offer screening and risk assessment, and if you may benefit from additional testing, you should talk to your doctor to see if you're appropriate for that.
So say it's not time for the mammogram yet, or they don't have that scheduled, but they're feeling something on their breast. What should they look for? What are some signs that say, maybe I better get to the doctor?
Great question. Many times when women notice changes in their breast, it can be subtle as a lump, skin thickening, dimpling, or skin changes, redness or bruising that you can't explain. If there are findings in your breast that you don't notice normally, you should definitely talk to your doctor. First stop is for a physical exam for them to check that area out. And then if needed, additional testing with specialized pictures may be helpful to find out what it exactly is going on in that area.
A lot of people out there, including myself, we're afraid when it comes time to go to the doctor. But the mammogram, it's probably something that even though you fear the doctor, you need to go there. Walk us through what you can expect at a mammogram.
So we have staff prepared to take care of you. They are licensed, and they'll greet you. They will be with you for about 15 minutes. That's what the appointment time takes. And you get your results in the mail via a letter, or if you have a Riverside MyChart account, you can get it online.
Now, I know that Tony over in the Valley asked you a similar question. A guy who's he's very famous for this, and he's very outspoken about it. The drummer for Kiss, Peter Criss, their former drummer, he's a spokesperson for male breast cancer. It happens in men also, right?
You're absolutely correct. Breast cancer can occur in men. It occurs in about less than 1% of the overall total diagnoses of breast cancer in the United States, but it is something that does happen, and it's important for men to be aware of that too. If they do notice changes in their breast or chest, they feel a lump, something that wasn't there before, they should still talk to their doctor about that to see if they need additional testing.
So this month of October that we're in now, it is Breast Cancer Awareness Month. And what would you say to somebody out there? I mentioned it a minute ago, people who are kind of hesitant or afraid. What would you say to somebody who's hesitant to schedule that mammogram?
I would tell them, October is an important month for awareness. Breast cancer does not ignore women the other months of the year. So it's important that we're talking about it now. It's on everyone's mind. If you have not gotten that first mammogram, our technology, our staff is there for you to provide you a safe and comfortable exam. And even if you've skipped that mammogram for a few years, it's never too late to come back in and get started again with that yearly. We know when you come in for those yearly mammograms, we can detect abnormalities at their earliest when they're easiest treated and give patients the best possible chance of getting good treatment and living disease-free.
So that person out there listening right now says, you know what, it's been a long time since I've had my mammogram, and I should probably schedule one of those. How can they do that? Where do they contact?
We have a scheduling department to take care of you. Their phone number is 815-935-7531. You can also go to riversidemychart.org. If you have your My Cheddar account, you can schedule through that. We have 3 locations, Kankakee, Bourbonnais, and Coal City, where you can go.
All right. Thank you very much. Dr. Rami Ramakrishna, and Allison Heil. Thanks for stopping by. And Caleb Miller, who's in the background. We're going to get you back to the music here with one from Tim McGraw. Baby, he's a real good man on WIVR 1017 and 1037 River Country.